Welcome back to Morning Rush. I'm Holly Furfer in Atlanta. So healthcare is one of the most important issues for Americans, and for many, it's getting more expensive. That's the focus of our new series, Premium Pain. And all this week on Morning Rush, we're looking into the growing cost of healthcare and the challenges Americans face when it comes to paying for it. And as America's population ages, the hidden price of caring for older family members is straining family budgets and the healthcare system itself. Take a look at this. From a New Scripts News and Talker research poll, 35% of people say they're very concerned about the cost of caring for an aging family member. Another 30% say they're somewhat concerned. And that's taking place already, even before expected changes to coverage like Medicare next year. Business and tech correspondent Maura Barrett joins us now. And Maura, all right, with all this information, what should people who rely on Medicare expect?
Well, enrollment season for Medicare is already open, and experts in aging recommend that you really review the fine print as you go over the plethora of options, because there are some small but really significant changes, including tightening rules for certain benefits that caregivers often rely on. 73-year-old Joyce Rogers is anxious about Medicare enrollment season.
We are low income and we can't afford all of that.
Faced with the question of how to prioritize her bills.
So when you're paying your rent, when you're paying out of pocket for different medications, and then you got to eat too, and everything's going up, what do you do?
While Medicare plans for 2026 do lower out-of-pocket costs on several expensive medications, there's a new pilot program that would require prior authorization for certain medical devices and procedures, and Medicare Advantage plans are tightening rules for supplemental benefits that used to be covered, like transportation to medical appointments and meals in the hospital. Cindy Cook helps clients just like Joyce in her work navigating healthcare for people who are aging.
Well, it's so overwhelming to figure out where to even, plug into the system. Gen X, the ones who have all the children, so they're really the sandwich generation now. They're caring for their older parents and then their children. And it's a lot of stress on them.
With a gap in federal services, family members are trying to step up.
The services that were there a year ago are not there now. It is a difficult time to be a caregiver, no question about it.
The AARP estimates family caregivers spend more than $7,000 a year out of their own pocket, about a quarter of their income. What opportunities exist in terms of relief for caregivers?
Understand your local community resources. Get involved with a support group if you can, because the support group's whole job is to understand how to support you as a caregiver.
So support groups like that, other local resources may be more prevalent in your community than you realize. Cindy, another woman you met there in the piece, actually just organized a fundraiser just last week, raising tens of thousands of dollars to go towards national nonprofit A Little Help, which helps elderly age in place in their own homes. And so there's a lot of added pressure on the so-called sandwich generation, people that are navigating these high costs but there's a lot of supplemental programs, a lot of people volunteering their time, donating to supplement what federal programs used to cover. There is a push for legislation that would provide a tax credit of $5,000 for working caregivers, and another that would expand uses for FSA and HSA funds, but they are still working their way through the process. And so experts emphasize you really need to lean into your community and support that way right now, Holly.
But there's always so much confusion navigating Medicare. So will people face the same issue then when it comes to Medicaid?
It's all really hard to follow, honestly. There's a lot of uncertainty with Medicaid, which is the situation that helps cover medical costs for low-income families, older adults, and people with disabilities. But it's not health insurance for older people. That's where Medicare comes in. And so the changes with Medicaid stems from the One Big Beautiful Bill Act that passed earlier this year, and it'll change who exactly is eligible to receive those benefits. It's going to cut down a huge chunk of people who can, but that's not going to take effect until 2027. The big changes that we highlighted for 2026 in regards to Medicare, those take effect starting in January. So that's what people are enrolling for now, Holly.
All right, Maura Barrett, thank you so much. Great information for us. We appreciate it.